Hey guys, Dr. Childs here. Today we're going to be talking about 5 reasons that you don't want an endocrinologist to manage or treat your thyroid. So I know this is going to be a little bit of a controversial topic, and I'll explain exactly why I think this is true for most people in just a second. If you don't know me, I'm Dr. Childs. I'm an internist. I specialize in treating people with thyroid problems, helping people manage their hormones, and of course helping people lose weight. So let's get into the topic today, which is 5 reasons, or just reasons in general, that you don't necessarily want an endocrinologist to manage your thyroid. Now, a lot of people are going to be confused by this statement because an endocrinologist, which is what we're talking about here, this is a doctor who specializes, or is supposed to have specialized, in managing the endocrine system, of which the thyroid is one of those things, and so on. But here's the problem. The way that doctors learn about hormones in general is very segregated. So even though you might think of an endocrinologist as a hormone doctor, it's not true that they actually are a hormone doctor. Okay, what ends up happening is most endocrinologists end up treating 1 or 2 conditions, and that's mostly diabetes, especially nowadays, and also hypothyroidism. Now you might think that the fact that they treat a lot of people with hypothyroidism as something that's good, but I'm going to explain why it isn't. I also want to preface this by saying, just because I don't think they're the best sort of specialist or person or doctor or physician who can treat your thyroid doesn't mean that they're terrible or that they cannot help you, okay? Now, there are going to be some people who use an endocrinologist who feel great. That's great for them. I'm not talking about you guys, okay? That's probably 20-30% of the population. I'm talking about the people who are not served by being treated by an endocrinologist because that endo is not doesn't have the tools or the mindset to help them get better, okay? So there's 2 groups of people here. Don't think that I'm saying all endocrinologists are bad here. So let's talk about problem number 1. And by the way, this is all sort of an extension of the growing body of literature that shows that thyroid patients are being underserved and undertreated by thyroid patients. Every year there's more and more data which shows and proves that this is the case. And if you're listening to this now, I think in 3 to 4 years from now, this is just going to be a commonplace thing, and all of these things should be fixed. Well, hopefully. 5 years is maybe a little ambitious, but by 10 years, I think this will definitely be the case. Okay, so number 1, they won't order the right test. Okay, so an endocrinologist is conditioned to order the TSH, and usually what they'll do is they'll order a TSH with reflex to T4. Okay, so free T4 usually. So what this means is that they'll always order the TSH, and if the TSH is abnormal, then a free T4 will be ordered as well. Now the problem with this is that, and I've explained in other videos, the TSH is not the best marker to use to evaluate the thyroid. In fact, I just read a new study that came out, well, newish, it came out last year, at the end of last year, and it was talking about the over-reliance on TSH is leading to a lot of people being undertreated. And this is part of the problem. You simply can't look at the complicated system that is your thyroid, or that is thyroid physiology, with one simple test. It does not work. And even adding in the free T4 is an insufficient way to get the rest of the information that you need. Instead, you need tests like free T3, you need total T3, you need reverse T3. You need to be checking the thyroid antibodies. These are just absolute necessary tests that you must be getting. And your endocrinologist will simply not order these tests. And we'll talk about why that is in a little bit in a second here, but you need to understand that they won't, or at least 99% of them won't. Some may, but it's not enough to just order the test. Your doctor needs to be able to look at the results and then change how they're treating in order to help you feel better. If they order the test just because you've asked them to, well, that does nothing for you if they're not going to change how they treat you. So reason number 1 is that they are very basically unlikely, or not likely at all, to order the right test that you need, which again is TSH, free T3, free T4, total T3, reverse T3, thyroid antibodies, and so on. That's reason number 1. Reason number 2 is that they all treat the same. So I hear this story all the time. Like I'll have patients who will go to their primary care physician or their family doctor. They'll read my information because they just haven't been feeling better for years and years, and they know, like inside, they know that something is wrong, that they're not being managed correctly. So they convince their family practice doctor to send them a referral to an endocrinologist, and they think that that's going to be the difference. They think that going to the endocrinologist is going to help them finally get the treatment they need. And that's not going to be true, because both family practice doctors and endocrinologists, and all endocrinologists, by the way, they all treat the same way. And I could very easily explain to you right now. They order the TSH, and if the TSH is high, they give T4, which is levothyroxine or Synthroid, to drop that TSH to the normal range. If that TSH is normal, you're normal. End of story, period. It is that simple, the way that they view this. And obviously, it's much more complex than that. But here's the problem. their knowledge is so standardized that they all think the exact same way. Okay, so it doesn't matter if it's wrong or if you're not feeling well. They don't view it that way. They view the thyroid physiology and thyroid treatment as a closed book, a solved problem. They don't think about it in the same terms that you do, in that you're being undertreated or mistreated or there's something wrong with you. In their head, everything's fine if this equation matches out. If your TSH is normal, you are normal. Now that's a problem, obviously, and a bigger problem is the fact that they all believe this, but you need to be aware that this is just the thought process, okay? This is one of the reasons that I don't recommend it. And in fact, one of the extensions of this is that they're so set in their ways, but we'll get there in a second. Okay, so another thing is that their knowledge is not necessarily greater, which is what this greater than sign is supposed to be. Their knowledge is not necessarily better than that of a primary care physician or of a family practice doctor or a generalist or whoever you're going to see, right? Whoever is your primary care physician. Most people think, like I said before, that an endocrinologist, by virtue of the fact that they've treated so many patients, must be more knowledgeable on hormone balancing than their family practice doctor. So they think that there's something hidden in their body that they're just not seeing, that their family practice doctor isn't seeing, and they think that will be unraveled or demystified by going to an endocrinologist. And I'm here to tell you that that's not true, and it has to do with this. I told you, in their minds, they've already solved the problem. It's not something that's open for debate. If your TSH is normal, you are normal. If you have continued problems or symptoms, then they're not related to your thyroid. At least that's how they think, right? And obviously this isn't true. This is why I have all the videos that I do. So if you fit into this category and all these things are like, clicking in your head and you're saying, oh yeah, that's me, or yeah, that's what they've said to me, I've heard this language used before, then that doesn't mean your thyroid is fine. There's probably something wrong with your thyroid. It's just been, like I said, mismanaged or mistreated somewhere along the line. But again, I want you to know that an endocrinologist isn't necessarily smarter or doesn't necessarily know more than your primary care physician. Now, it could be true, right? It could be true. And you like to think in your head, well, if all they do is see hypothyroid patients, surely they must be better at treating those hypothyroid patients. Well, not really, because if they don't think anything's wrong, then everyone gets treated the same way using this equation, and there's nothing to fix in their head, so they don't ever try to necessarily learn more or understand more about it. So just realize that just because they are a specialist doesn't mean that they actually know more. Now, this is not always true, by the way, of specialists. In fact, most specialists do have specialized knowledge and understanding. Like if you talked about a urologist or some sort of surgical specialist, they would absolutely know more than your primary care physician would. So this doesn't apply or translate to other fields. I'm talking specifically about endocrinologists. Okay, so that's number 3. Number 4 is kind of an extension, as I said, of number 2, and that is that most endocrinologists are really set in their ways. In their head, like I said, they don't believe that there's anything that they don't already know about thyroid management, so there's nothing to fix, right? And so they've already been doing this for year in and year out. Remember, endocrinologists have an extra 3 years of training on top of the primary care physicians. So they've done extra training, they've done extra education, they go to conferences that all spout the same information. They're kind of in the same echo chamber where they hear the same thing over and over again. In fact, I've even seen newer studies which show that patient education, like what you're getting here, they consider that a hindrance to their ability to treat you, by the way, which is laughable. But that's really how they're viewing this, okay? So they are, in fact, mostly set in their ways, because a lot of people, what they do is they think this, and this, again, will be kind of an extension of this one down here, but they think, well, what I read online, or let's say you just see my information. Let's say you read my information and you think, this makes a lot of sense. This person even has links to certain studies which show that this is the case. If I can just bring this information to my doctor and I can show them that this is what I need, that the light bulb will turn on and they'll suddenly realize that they've been treating me wrong and that I'll get on the right treatment finally. And that's so unlikely to happen. It does kind of happen. We'll talk about who you should see in just a minute, because it is kind of a possibility. But it's so unlikely to happen because they are so set in their ways, because they live in these echo chambers, because the pharmaceutical industries which sponsor the studies for levothyroxine and Thyroid keep feeding them the same information. They're so set in their ways, they're unlikely to change their minds in terms of how to treat it. So that's number 4. Again, kind of an extension of number 2. And then number 5 is you won't be able to change their mind usually. So what I say for most people, well, let's just start here and I can kind of give you an idea. So the idea is, after reading all this, you might think to yourself, well, what am I supposed to do? Who am I supposed to see? So here's kind of the order of events that I would recommend you go down. So the first thing you should do, the first person you should start with is your primary care physician. So hopefully you can see that. Yeah, you can. So start with your primary care physician, whoever that is, because they are sort of in a general state. They have a much broader understanding of a lot of different conditions, And they have seen a lot of different things usually, and they realize that there's not a cookie cutter approach to a lot of therapies, right? There's always people that are outliers. There's always people that don't do well in the standard treatment. There's people who need different medicines or different doses and so on. They understand this intuitively. So your PCP is actually better than your endo at trying new therapies and trying to do new things. So always start with your PCP first. So we'll put that a little first there. Now, if you can't get success with your PCP, whoever that is, then it's worthwhile to try an endocrinologist. I think always try one, even though there's probably like, a 1 to 2% chance that they'll help you or they're willing to change their mind and do the therapies that I'm talking about. It's still worthwhile to try because they're covered by insurance, generally speaking, by the way. And because if possible, they would just be an easy way to get your medicine. But always start with the PCP first, and I would say about 2 to 5% of the PCPs would be more likely to use different therapies like T3 medications and so on. So start with the PCP, go to the endo, but do not waste your time and don't necessarily try to convince them to do something that they're unlikely to do. It's going to waste your time and energy, and you're just going to spend months and months and months feeling crappy when you don't have to. So these are the first 2 steps. This is how I recommend it. Then, if these options don't work, then you have a couple of different options. I recommend going to an integrative doctor. Actually, there's a couple specialists, so let me write these down. And we'll just type, actually, you know what? I won't write them all down. And so we got integrative, anti-aging, and functional. So here's the 3 other doctors that you can try. You can go and try and see somebody, a physician who specializes in integrative medicine, anti-aging medicine, functional medicine, and there's actually one more, and that would be a doctor who specializes in BHRT, which is bioidentical hormone replacement therapy. So you have 4 different doctors who have some subspecialties. These aren't like residencies that these doctors go to, but they are proficiencies in certain types of medicines or the study of different medicine. And these doctors tend to be more likely to use the therapies and the hormones that I'm talking about here. So start with the insurance-based people, so that would be PCP and endocrinologist, and then move to these. Now, one of the downsides of these doctors is that they almost always take cash. They don't take insurance, so it's a little more expensive. There are fewer of them out there, so it might be a little harder to find one. But trust me when I say it will be worth it. Spending your time to get the right treatment will save decades of your life. In fact, the most important stat that I can leave you with is that we have thyroid patients who have been mistreated for years. We have surveys of these people. We say, hey, how long has it been since you felt better? And they write down on there, well, I've been suffering from these issues for 10 years, 15 years, and on up. And it's like, if you were in that situation, it's not worth that 10 or 15 years of your life to be suffering, to feel crappy for that amount of time when there are solutions and answers to your problems. So I'd leave you with that. Now, what I want to hear from you, by the way, leave this in the comment section. Let me know if you've seen an endocrinologist. Have you had success with an endocrinologist? Because if you had, I'm really interested. Feel free to even leave their name down below, because again, it's very rare. We're talking 1 to 2% of them are willing to work with them or work with you as the patient. And if you have not had success and you've tried someone else, have they helped you? Leave that information below. It's really helpful for those people who are still struggling. And of course, if you have any questions, let me know as well. Also, don't forget to download my free thyroid PDF resources. I'll have the link down below. I have tons of resources that you can download for free. They help you with stuff like this. So if you found this helpful, I think you'll really like that information. And otherwise, I'll see you guys in the next one.